how many cases of the Zika virus have been confirmed here in Canada?
Well, we're monitoring the situation very closely in terms of the spread of the Zika virus, and as of today we are aware of 3 confirmed cases in Canada, and those were all acquired outside of Canada, folks that were traveling in areas in South and Central America. And to date, there have been no cases of locally transmitted Zika virus, and so the primary message is around travel. And people are certainly welcome to go to the Public Health Agency of Canada website. It is a great resource in terms of understanding what the travel precautions are, and we certainly are encouraging people to take appropriate preventive measures to avoid mosquito contact. And also we're advising people that if they're considering travel to the affected countries, that women who are pregnant or considering pregnancy should consider postponing their travel.
It still takes a while for this to actually incubate and for symptoms to start to show. So what if people have already taken trips and they're back? What should they be on the lookout for?
Well, the number one thing that I would say to people is, if in doubt, or if a person is experiencing flu-like symptoms and has traveled recently, that they should see their health provider to seek advice, and certainly people that are considering travel should also seek advice from their health provider.
But are there symptoms that they should really look for after they come back to Canada?
Well, the symptoms of Zika virus infection are range, but they are generally flu-like symptoms of malaise and aches and pains and other flu-like symptoms. So if in doubt, certainly we encourage people to seek care.
The UN is warning that this virus is spreading explosively around the world. It's very concerning at this point. We have no locally transmitted cases yet in Canada. Is it a possibility that it could start to spread come springtime when mosquito populations rise?
So this is a situation that's being monitored very closely by, of course, the World Health Organization, and my officials at the Public Health Agency of Canada are monitoring this on an hourly basis and in communication with our partners at the World Health Organization. At this point, we have no reason to believe that Canadians would need to be concerned about local transmission. The particular mosquitoes that transmit the virus are not known to be in existence in Canada. These are mosquitoes that are primarily found in the southern United States, in the Caribbean, Central and South America, and so obviously we will continue to watch closely. There's a tremendous amount to be learned to make sure that all of the utmost precautions are undertaken, but Canadians don't need to be concerned about local transmission, even in the summertime.
Even in the summertime? Okay.
That's our understanding at this point, and if there are any changes in that, we'll certainly update folks.
The UN is holding a meeting, an emergency meeting on this issue on Monday. Will Canada be taking part in that meeting?
So it's my understanding that there is an emergency meeting of the World Health Organization, and as I said, my officials in Public Health Agency are in close correspondence with those folks, and we will interact in that meeting in an appropriate fashion, and I can give you more details hopefully in the days to come.
With previous outbreaks that we've seen that have gone global, they start off in local areas and they soon spread beyond control. If this becomes a larger problem in Canada, is our health system prepared for such an outbreak?
Well, as I say, the issue of local transmission is not a concern at this point. Our concern is, of course, with travelers. And we need to be careful in terms of, I don't obviously want people to panic, I want people to be wise and informed. But sometimes what happens is that as the knowledge grows, it can appear that an infection is spreading, but in fact it's a spreading of recognition of the problem. So this is something that obviously we have a very heightened recognition of at the moment. And there's a lot of work being done in terms of actually understanding more about the pattern of spread and how rapidly it is spreading, or whether in fact the methods of detection and the testing have changed along the way, which has led to the perception of a heightened spread of the virus. So those are all pieces of information that I will be gathering from all of the appropriate officials, and we'll have much more to say about that in the days to come.
Are you confident, though, that Canada's health system is prepared for any outbreak like
Canada's health system is in excellent condition. Obviously, medical officials and medical providers across the country are being informed about this situation, and frontline health workers are being informed as well to be able to be on the lookout for the condition and institute the appropriate testing along the way.
Is Canada Blood Services taking a look at this in case anybody had possibly donated any
blood
with the virus in it?
Yes, as you can imagine, this is something that is an active and evolving situation. So Canada Blood Services and AMEC Quebec are very aware of the situation. You may know that these organizations do routinely ask questions about travel as part of their screening process, and they will look at whether or not there need to be any changes to the questioning, but they also have retrospective data in terms of people's travel patterns.
All right, last bit of advice for Canadians at this point?
Stay up to date, check the Public Health Agency of Canada website. If you are considering travel to the affected regions, of which there are about 20 countries now that we know have been affected, we certainly encourage people to, if you're pregnant or considering pregnancy, to consider postponing your travel. Otherwise, if you proceed with travel, please make sure that you cover up, wear protective clothing, and try to avoid mosquito bites.
Sorry, I do have one other quick question. That wasn't the last one, but in a rapidly evolving situation like this, when you're dealing with outbreaks like this, how difficult is it for government scientists and health officials to really have their finger on the pulse of something like this?
I am incredibly impressed with the work of the Public Health Agency of Canada as well as the medical community across the country. As you know, with previous outbreaks, Canada has played a large and important role because of our expertise in a number of areas in infectious diseases. In the Ebola outbreak, for instance, Canada played a very important role in that. And so we have a fantastic team of scientists across the country who will step up and do their part and are very actively engaged in this situation.
Thank you very much. I really appreciate it.
Thanks.